So most people just are not aware of that or forget that, and we want people to never make that mistake. We don't want anyone to see we don't want to see anyone lose their access to future insurability or to misunderstand the long-term ramifications of this.
Welcome to the Live Greater View, a financial planning podcast produced by VLP Financial Advisors that discusses life, money, and perspective. We help clients live their best life at every stage through our VLP Live Greater partnership process. Thank you for tuning in.
All right, so today we got a great topic, Medicare, one that's often a lot on people's minds. And one of the most challenging scenarios we see when clients turn that age is trying to figure out how Medicare works. So today we have joining us Emily O'Halloran from MP Group, who's a great professional that we work with locally in the area. And all over the country, you have access to do stuff. So Emily, why don't you tell us a little bit about MP Group, and then we'll dive into Medicare, eligibility, enrollment, and beyond.
Sure. Thanks so much for having me. I always love talking about Medicare. You guys know that. So MP Group, we are a group of independent Medicare insurance agents with a focus on Medicare education and enrollment services. And so while we are located here in the DC metro area, we serve 36 states now and really growing because the vision is that we want to come alongside people and help them understand Medicare better before they make any decisions. And then as time goes on, as they're revisiting all of their decisions and life changes, we're there to help it just make more sense and make good choices.
And I love what you said, which I think is absolutely 100% about your group, is the education part. You guys do a great job. It's really just helping people understand what their options are.
Yeah, and when clients, obviously this will come up in conversation with planning, and we feel so comfortable having your group there as a resource to us. Medicare is one of those things where there's so many rules, they're consistently changing. Obviously, it's high stakes when you talk about healthcare and money. It's just so nice to have somebody who that's all they do and that's what they specialize in. So, we've had nothing but great client feedback for your team.
Oh, awesome. Thank you so much. We do really enjoy helping people save money and make good informed decisions. So it's fun.
Great. So why don't we kick it off? What is Medicare? So let's start there.
So that's something that most people do not become familiar with until they approach their enrollment. And you hear about it and you see the Medicare for All bumper stickers and it's like, what is that? So Medicare is our federal health insurance for seniors 65 and older, but also some other eligible individuals who will be under 65. And that's for everyone, regardless of income. So this is something that eventually, unless something changes, we all will be on Medicare at some point in the United States.
Yep. And some of the backstory, it started in the late 60s. There's been a couple of changes, but the historical aspect, can you just talk about that a little bit? We just always think that's interesting. What did we have before and how we got here?
Right. So that's a really fraught question because so many of the things about our culture that necessitated the establishment of Medicare have changed over time. If you think about, we're coming up on, that 60-year time frame where how people get health care, what's considered health care or what's considered medically necessary has changed over the years. But Medicare is a set of laws, and if you think about how there's a lot that goes into changing those laws. And so often what has happened is instead of saying, okay, we're going to completely scrap it, redo it, and start over, which would have been a really good idea at some point, instead it's just been layered. And over the years, these changes have led to something that most people just don't even recognize when they compare it to the types of insurance they've had the rest of their lives. And so the fact that it's so brand new and confusing and there are so many potential pitfalls, it really becomes overwhelming to people as they approach that age 65 general eligibility date.
Right, and that leads us to our next point here. So when we're in our financial planning software, we're working with clients that are trying to map out, the next 3 to 5 years of working and then ultimately retirement. Obviously, age 65 is that big line in the sand where they see that on the horizon, and this topic comes to the forefront. So let's just talk about who's eligible, things to be aware of as we, get to that age.
Sure. So When you turn 65 and you have achieved the right number of credits in your Social Security eligibility status, so it's going to be 40 quarters or 10 years, and people will have eligibility also based on their spouse or a former or deceased spouse as well. So as you approach that eligibility, you have other things to consider. Are you or your spouse still working? If you are, is it a large enough company? Does that company provide employer group coverage? And so if you are turning 65 and you are going to still be on a large employer group health plan, we like to explain to our clients, well, now you're in the driver's seat. So you get to say, what's more affordable? What do I like more? Do I really like my company's plan? Is it easy to use? Am I used to it? Is my company paying the majority of the monthly premium? And if so, that's probably going to be more affordable, and you're going to want to stay on that plan and postpone your Medicare enrollment. Not everyone can do that. People who don't have a large employer group health plan at 65 must go on Medicare, and not everyone understands that. So we'll have people stay on an exchange plan or just some kind of private
Or even
insurance. Cobra is a real problem.
Yep.
People assume that because they're still on what they consider their employer plan, that it's the same as being on the employer plan as the employee, and it's absolutely not. So COBRA is not creditable for Medicare after age 65, meaning if you are on it and you are over 65, you need to talk to someone fast.
What do they define as small employer plan?
So in this case, when we're talking about just your requirement to enroll in Medicare, they're looking at employers of under 20. So there's going to be a lot of people with small practices or just, working on their own, but maybe they have a couple of employees or family members on a plan who don't realize that they do need a pivot over to Medicare. And we want to be sure we're talking to them. So, ultimately, we want to talk to people as they approach 65 regardless, so that we can assess what their coverage is, teach them about their options, give them, maybe you would call it like a wellness check, like in terms of what their coverage is, like, you're good, you can stay, don't worry. And because there are so many downsides to missing your enrollment window for Medicare, people are always panicked about it. Like, are you sure? Are you sure? Do you promise? I promise. You're not going to have a late enrollment penalty. Your coverage is good. Call me when you retire. So it's helpful to have that conversation and be reassured that someone's coverage is good at age 65 and they can postpone Medicare.
Right. And in conversations with clients that are, leading up to this age, occasionally they'll have done some research on their own. They'll, go down the rabbit hole that's, on the internet and look at, different things as it relates to Medicare. And they're kind of grabbing information from here or there, and they come up with these different assumptions.
Yes.
We've had a really great experience with your team in that you actually start everybody from, hey, here's point A and here's where you start, and then you kind of help navigate them through all of these different options that they have. So I thought it would be good for us to kind of just start and talk about that starting point, and then walk through kind of what a typical assessment process looks like for a client who's turning 65.
Sure. And that's so great to hear, because we do spend so much time having that same initial conversation. Let's take a step back and let's talk about how this works and how these different parts come together. Because if you don't understand that, you're right, you're going to be hung up in the things that you've read or the things that your peers have said, and you can walk away with some misconceptions pretty easily. So what is referred to as original Medicare, so that's the Social Security term for Part A and Part B. That's the foundation of everything. So all of your choices start there, you get that first, and then from there, that's where the different types of private insurance come in. We categorize that into two different major options. The first option is you keep Medicare, so literally the federal government is your primary insurance. You keep Medicare A and B as your primary insurance, and then you want to add a secondary insurance, because with just Medicare A and B, there are unlimited out-of-pocket costs. There's no annual maximum, there's no lifetime maximum. And one of the most dangerous unlimited costs is the coinsurance on Part B, which is 20%. So you can imagine if you've ever looked at an EOB and seen a surgery, and you've seen where the cost of that surgery was $200,000,
Yep.
no one wants to be responsible for that 20%. So that's one of the the things that adding a secondary insurance, a Medicare supplement, does is it's going to fill in those gaps. That's why they're called Medigap plans informally, but Medicare supplements are what Medigap plans are.
Let's talk about what A covers and what B covers. I think that would be great to define.
Sure. So Part A is called hospital coverage. The better way to think of it is that it's inpatient care. So you might be admitted to the hospital, but you might also be admitted to skilled nursing, which can be in a facility or even home, or admitted to home care or admitted to hospice. So that's like admission is kind of the standard. The emergency room is located at the hospital, but that's not Part A. So Part B, and this bugs me, they call Part B medical insurance. I feel like when I'm at the hospital, that too is medical. So the better way to think of Part B is outpatient. So Part A is inpatient, Part B is outpatient. So over those many decades now since Medicare began, so many things that used to be inpatient care, we do outpatient now.
Right.
Yep.
Major surgeries and other procedures, chemotherapy and radiation and things that have massive cost to them are going to fall under Part B now. So we've seen a shift culturally where more healthcare does fall under outpatient care.
Wow, great point. Yeah, it has changed drastically over the years.
So the foundation, like you just said, is A and B, and then from there's the supplemental side or the advantage side. So those two pieces, the supplemental and advantage, that's really what we see all of the advertisements for, and a lot of the different things that are covered in the media. Can you just speak to some of the common things that clients might see either on TV or online as it relates to those two pieces?
Absolutely. So going back to those two options. So option one was you keep A and B as your primary insurance, and you add the Medicare supplement, the Medigap, as your secondary. Option two is the Medicare Advantage program. And so that is what, so you have plans that are offered by private insurance companies that are going to be replacing all of your Medicare benefits. So when you enroll in a Medicare Advantage plan, you still have to pay for Part B, and we haven't really talked about costs yet, but Part B does have a monthly cost. But you're basically transferring your coverage from the federal government to a private insurance company. When you enroll in that plan, you can't pull out your Medicare card and use that at a doctor's office. You have to work within the parameters of that plan. Now, those are going to be managed care plans. And typically, originally we saw a lot more HMOs. We're seeing more PPOs these days, and the difference there is that with an HMO, you won't have coverage out of that plan's network. And with a PPO, now Medicare Advantage PPOs, you can use any doctor that takes Medicare outside of the network, but it's a little more complicated than that. So these managed care plans are replacing your Medicare benefits, and there are some pros and cons. So there's going to be trade-offs like ease of use will be potentially more challenging. You might have more requirements for referrals or prior authorizations for treatments and services that otherwise would have just been automatic under original Medicare. The difference in who you can see on original Medicare, over 96% of all healthcare providers in the country take original Medicare A and B.
Wow.
So you don't have a network, or one way I describe it is your network is as big as almost every doctor in the country. That's
Pretty sizable.
Pretty cool.
Yeah.
On the Advantage plans, though, you do have a network, and you're really going to want to focus on staying within that network in order to minimize your out-of-pocket costs, which are going to be higher on that side.
So supplemental and advantage. So we've had a good conversation about the basics of those. What are some of the factors that go into choosing which one of those makes the most sense?
Sure. So it has a lot to do with your preference for fixed monthly payments. So on the Medicare supplement side, you're going to be paying a monthly premium to that insurance company and having a very minimum out-of-pocket responsibility for your health care. So you can have a year where you go to the doctor twice. Cool. You're going to spend X number of dollars. For the same number of dollars, you could have a year where you're in and out of the hospital 6 times and rehab and surgery, but your premiums to that Medicare supplement insurance company are what are dictating what you're going to spend that year. So it's very stable. You're going to be committed to more out of pocket for that Medicare supplement, but it's insurance. You're hoping that you don't get your money's worth out of it.
Right.
On the Medicare Advantage side, this is often what will attract people to these plans. You'll see very low monthly premiums, even premium-free plans. And of course, you mentioned the commercials. These are the plans that, because they're offered by these private insurance companies that are paid by Medicare to cover Medicare members on behalf of Medicare, they are rolling out the red carpet. We have all of the things that you want, and they're really going to push those low premiums. Some now you'll see the give back where they'll say, we're going to pay part of your Part B as well, because you can't get lower than zero. So how do you get lower than zero? We're going to give you something. So though you're really looking at what you prefer in terms of cost. You prefer to be committed to a higher monthly amount, knowing that your healthcare could be minimal or a lot more than that, and your costs will be the same. Or are you comfortable with having a low or no monthly premium, but then in those plans you're going to be paying as you use healthcare? So you'll have potentially a deductible, you'll have co-pays, you'll have co-insurance up to a maximum. So that's your protection. That's really important. But you could have very high expenses in a year where your healthcare needs are higher. So you're looking at what your budget priorities are, what your healthcare needs are. I'll have a lot of people say that they want an Advantage plan because they know they're going to save money because they're healthy. They don't take any medications, and they're
healthy
super
now.
fit.
Yeah.
There you go. And that's great. I mean, that's to be congratulated. Sometimes it's luck and sometimes it's hard work, but it's also something that can change any day for any of us.
So that's a great point. Let's talk about, you select an Advantage plan.
Yes.
You're now not so healthy. Things have changed. Well, now you want to go to Medigap policy. What's your issue?
Okay. Oh my goodness. This is one of my top priorities to talk about today and with everyone that we work with, because one of the most common misconceptions about these two choices, having a supplement with Original Medicare versus Medicare Advantage, and especially this time of year when we're talking to so many people, even people we've worked with, we've done our best education, but it's easy to forget the details. People will say, oh, it's open enrollment, it's annual enrollment. I'm going to look at other Medicare supplements. And I have to remind people, Medicare supplements are not a part of the annual enrollment period. They are not something that open up to everyone regardless of your health status once a year. You have a very fixed period of time to enroll in a Medicare supplement, and it is defined by your first 6 months of having Medicare Part B. Now, there's a handful of extenuating circumstances. Apart from that, they're called guaranteed issue rights, and they vary from state to state, but they're extremely limited. And I think one of the biggest mistakes that people can make is having this misunderstanding, assuming that they can just get a Medicare supplement anytime.
Right.
Because outside of that first 6 months on Part B, generally speaking, it's going to be a medically underwritten application. We're going to ask all the health questions. They're going to get your permission to run your records, see all your prescriptions, talk to your doctors, and we are seeing underwriting become a little bit more difficult in recent years. And it's very possible that you would no longer be eligible for a Medicare supplement once you have kind of gotten out of that window of time. So most people just are not aware of that or forget that, and we want people to never make that mistake. We don't want anyone to see we don't want to see anyone lose their access to future insurability or to misunderstand the long-term ramifications of this.
Which is great reason why doing this planning before you hit age 65 really makes a lot of sense. Even if you decide that you don't need it because you're with a big employer still, but you're getting the pieces in place for when it is time to understand what your options are.
Exactly.
Right.
Yeah.
Yep. And naturally in our financial planning process, we'll obviously map out with clients things that they spend money on normally for everyday expenses, and then a big component of other things that we talk about are travel.
Yeah.
A lot of clients have a separate budget for travel throughout the year, so I thought that would be good for us to unpack the different coverage impacts and how that impacts travel and things that people should keep on their mind.
Yes. So first, referring to travel outside of the United States, there's a very hard and fast rule that Medicare A and B does not cover anyone outside of the United States, period. Literally, the only exception is you get hurt at the border and the closest hospital is in Canada or Mexico, going to the closest hospital will be covered. But that, like, when's that
Very
gonna
rare.
happen?
Yeah.
So other than that, you are not covered by Medicare A and B outside of the United States. So if you have A and B and you have a supplement, when you travel outside the U.S., you'll have certain plans will give you some coverage for overseas emergencies. Now we're starting to see some Medicare Advantage plans will cover overseas emergencies. So it's limited, and what we usually tell people is if you're concerned about coverage outside of the U.S., definitely want to look at trip insurance. So you shop for a plan that covers whatever level of health needs you might want for the location you're visiting and the amount of time that you're going to be gone.
Great.
So
Nice.
we tell people to do that because other than what I just referenced outside of the U.S., you're on your own.
Yeah.
The inside the U.S. situation is a little bit easier to address. So if you have A and B and a supplement, you have access to every doctor that takes Medicare around the country, and you don't need referrals. So you don't have to reach out to your primary care specialist to get a referral to see a pulmonologist if you get sick when you're visiting your daughter and her kids in California. So it's very easy to use. The Advantage plans, if it's a PPO, you're going to have coverage outside of the network. Now I mentioned earlier, it's not always all it's cracked up to be. You might have to pay the provider and then submit for reimbursement and be responsible for some difference in the amount paid. But you are going to have coverage with any Medicare Advantage plan for emergencies and urgent care. That's just not always what you're going to need. So I had a conversation just this morning with a woman who had an HMO Medicare Advantage plan, and she was in Florida, but she was visiting family in Connecticut, and she thought she maybe had, something that needed to be addressed. And she said, I'm not going out of network. I'm not going to go to the doctor. And she didn't. And she got worse. And so today we were talking about a PPO.
Right.
So it does make a difference who you can see and for what reason. You don't always want to be limited to, is this an emergency? Is this urgent? Or am I going to wind up paying this bill? It's nice to be able to just call
Yeah.
a doctor and say, do you take Medicare?
Yeah, that's our biggest concern is, especially when it comes to your health and when you're older, is you don't want to be making medical decisions based on the fact that your policy might be out of network.
That's right.
Because it could be very costly.
That's right.
Not even just money, but to your
Your-
health
your
and to
health.
you, period. Yeah.
Absolutely.
Yeah.
And as far as other common questions that you've been getting recently, something that's grabbed a lot of headlines is some of these weight loss drugs. It seems like that's becoming a bigger component of the overall healthcare industry. I know from the investment standpoint, that's having a big trickle-down effect on different companies and different parts of that industry. Has that really changed anything as it relates to Medicare, or where are things at as far as Medicare with those drugs now?
So that ties into what I describe as the Wild West of Medicare, which is Medicare Part D.
Part D.
So think D for drugs, and that's the part that we haven't totally mentioned. So if someone has A and B in a supplement, they will also need a separate standalone Part D plan. If they have an Advantage plan, Part D benefits are typically built into that plan. But I say it's the Wild West because it is crazy what you can pay, the difference in what you can pay for the same medication at the same pharmacy, depending on what plan you have, depending on where you are in the coverage stages that Medicare has for all Part D plans. That's where that infamous donut hole comes in. And when you understand the coverage stages and why they exist, it's like, okay, that makes sense. It's protecting everyone, the consumer, the manufacturers, the insurance companies. It's so complicated that the impact on the Medicare member is, I paid one amount in January. Now I'm going to go pick up my medications in April. And it's like walking up to the counter and just waiting to hear what you're going to pay, because it could be 3 times as much. It could be
Even
half
more.
as much. Maybe you met your deductible and now it goes down. In July, you're going to maybe be in the donut hole. And this is all dependent on the plan and what the medications are. Imagine how the consumer feels getting to the counter to pick up their medications and having no idea what number they're going to be paying that day.
I've actually had this conversation with a client who said they weren't, they needed an inhaler. They've got, really bad
Really
asthma
bad.
and breathing.
Yeah.
And it was November, and she was just going to make her last inhaler till the end of the year work because she was hit the donut hole. So I had to have a conversation of, no, we need to breathe.
Yeah.
So we're going to take money out of the portfolio. But these are real conversations we see if they haven't planned or thought through or haven't done the due diligence to, and maybe we'll talk a little about this, is to actually go through their drugs and the plans to see where they're tiered.
So the things like the weight loss drugs and any medication that you see on TV, if you see it on TV, there's a big price tag, and that is going to make the variability of the cost. It's going to be outrageous. It could be one amount on one plan and a completely different number on another. Those are an example of that. Inhalers are another example. And this time of year, we're spending so much time just trying to re-educate our current clients and educate new clients on how all of this works and what to expect. And, if you have a deductible, we'll have people say, I went to pick up my medication and it was going to be $600, so I didn't pick it up and I didn't take it the rest of the year. No, that was the deductible. Yeah. It was going to go down to, $120 for 3 months after that. So we do spend a lot of time, especially this time of year, taking the client's medication information and using the search tools to map out what plan is going to have the lowest total cost. So you have to factor in everything, the monthly premium, the out-of-pocket on the medications, the deductible if there is one, and we map it all out, try to explain to them, this is your total cost for the year, but it's not always going to be the same amount each month, and hopefully help them understand and prepare for it, like you said. But not only is it difficult one time, it's difficult every year because what changes from one year to the next can be almost everything. And again, talking to people right now about next year, I have people saying, why did my premium go up 61%? It's basically not the same plan. About the things that are in common from 23 to 24 are the name of the plan. And sometimes that's not always true. So you have to look at this every single year. And as new medications become available and they become hot, like those weight loss injectables, that will impact what the plans do for the next year and what they cover and how they set up their copays and coinsurance. So it's something that you really have to stay on your toes. And if it's not something that you understand, work with someone who can explain it and at least get you in the lowest total cost.
Yeah, absolutely. Plan. Great advice.
Yeah, and as far as cost, I know that that's something that we really try to take into account when we're working with clients, how much money we distribute from a portfolio to make sure that we don't go above certain brackets, and we know that there's a 2-year look back period. Can you just talk about some of the common pitfalls around that and just things that clients should be aware of outside of the fact of just don't have a income that jumps to an extreme level in your 60s?
Yeah, 60s or 70s or 80s. Yep. So the term is IRMA. I know you guys know it at least as well as I do. So those are the income-related monthly adjustment amounts. And when people are working with financial advisors, they're generally prepared for that. So I hate to have the conversation, though, when people come to me from someone else, and I'm the first one to explain, yes, Medicare is means tested.
Oh, you sold all that Apple, you sold that stock, and oh my gosh, yeah.
So it's sometimes a shock for people, but what's going on with those charges is that's the means tested side of Medicare, and we were looking at about 3 years ago, about 5% of people on Medicare were paying those charges. We're up to 8% now. As Medicare grows, meaning like the population of Americans that are on Medicare, because we are trending in that direction. It's over 10,000 people a day now turning 65, but that number is growing with fewer people working and paying into Social Security, Medicare for covering everyone. So we're going to probably see those brackets potentially, I shouldn't say probably, potentially we'll see those brackets lower, or just the percentages that people pay when people are paying those Means tested amounts, those IRMA charges, are something that are determined every year for the rest of your life that you're on Medicare. So you do have to be aware that they're always looking at your modified adjusted gross income from 2 calendar years previous and making adjustments over time. And there are ways to have a redetermination on what you pay, but we've seen people in their 90s who have big jumps in what they pay for Medicare based on changes in their income. So it's definitely something to, again, stay on top of. Who knew there was so much work in retirement?
Yeah, and we see that a lot. I mean, we spend a lot of time planning with clients, especially when you get to a period where they didn't have requirement distributions and they do, and all of a sudden they're coming back and going, well, now my Medicare is my coverage is so much more expensive, and we try to have that conversation and do other things.
Yeah. Awesome. Well, we're in the middle of this year's annual enrollment period, so I thought it would be good for us to talk about some of the potential changes for 2024 and just get your thoughts on that.
So the most significant change that's occurring in 2024 is a change to those coverage stages I mentioned under Part D. So up until the end of 2023, we've always had this 5% coinsurance that someone would pay when they got to catastrophic coverage. So someone might have an extremely expensive, just as an example, like an oral chemotherapy or immunotherapy, where they would have such a high cost of the medication they're filling, they would go right into catastrophic coverage the first time they filled it in January. Now they're still paying 5% on that high cost medication all year long. And that causes out-of-pocket costs, in excess of, we've seen numbers as high as personally, I've seen numbers as high as $33,000.
Wow.
And so recent legislation has addressed that. And in 2024, there is now a 0% coinsurance when a Medicare member reaches catastrophic coverage. So that's going to mean that people who are taking those life-saving medications that have a really high cost are going to be able to afford them. So their cost will be, it's not easy math, but around $3,300 a year when maybe they were spending over $12,000-15,000 a year.
So that's a good change.
So that's a huge change, absolutely. Yep. And then we are looking at potentially, or it's been planned that we'll have an out-of-pocket maximum on Part D for the first time in 2025. So next year, this time, will be really interesting trying to figure out Part D costs and how that's all going to happen, getting to that out-of-pocket maximum.
Interesting. Great.
Yep. And, I know that you've been getting swamped with emails and phone calls of, clients trying to get their coverage in order for next year, and there has to be some sort of commonality with some of the questions that they're asking or things that are on our mind. So, we thought that it would be good just to talk about what you think the top 3, misconceptions are when it comes to Medicare.
Oh, yeah, for sure. So, and in the commercials that are out this time of year make everyone think about Medicare. Mm-hmm. And what I think are the top 3 misconceptions are all tied to cost in one way or another. So I feel like the most surprising is how many variables go into what your Medicare costs. And that's something that people get overwhelmed by. And so something like that might draw someone to an all-in-one plan, but it's something that they want to do under advisement and should really be careful about that.
Yep.
And then I think the second one falls into the category of annoying, which is what Medicare doesn't cover. And we think, like, why does Medicare not cover dental? That's a part of your health.
Yeah.
Well, it wasn't considered a part of your health 60 years ago, or glasses or hearing aids. And then I think the third is what's the most perilous. And the most perilous is that Medicare doesn't cover long-term care.
Yeah.
And that's something that can sneak up on people. And, we're always grateful and happy for people to know that they understand that and are planning appropriately for that, because Medicare is not the solution for custodial long-term care when people get older.
Great. Well, a lot to unpack, as we know, and this has been fabulous. I mean, it's been great. I think a lot of people don't understand the difference between, Medicare A, B, and then having these supplement gap policies versus the Advantage plans. I think you've done a great job. It also reminds us that there's so much that goes into this, that spending time with a group like yours really does move the needle in what their expenses could be, and just planning on being able to pay for that, and knowing no surprise, minimizing surprises. There might be some surprises, but minimizing the surprises. So talk a little bit about how your group, how they can contact you, and how you guys get compensated.
Sure. So easiest to just visit us at our website, mpgroup.org. many people know us by our former name, recent name change due to a new Medicare law. We used to be Medicare Portal. So we are MP Group, did I just say .com?
Yeah. No, you don't have to. It's
We're
fine.
mpgroup.org.
Yeah.
So I need to probably say that again.
Gotcha. No problem.
Yeah, so the best way to find us is at our website, mpgroup.org. Some people know us as Medicare Portal. We made a recent name change due to a Medicare law, and now we are MP Group, mpgroup.org. We don't charge any fees to our clients, so we work as independent Medicare insurance agents, and the plans that our clients select, we receive commissions from those plans, and those insurance companies for many parts of Medicare have a set commission amount that's established by Medicare. So the incentive isn't to say, oh, enroll in this plan. It's to say what's going to work for you. And that makes it so easy to do what we do. So people that work with us don't pay anything more for their Medicare insurance than they would if they worked online and just enrolled online on a website or called a call center. And we feel like we add certainly a lot more education and explanation, and then,
And a website.
Future help along the way. So yeah.
It would be time well spent, reaching out to be able to have a conversation with someone who can dive into your personal medical position, and especially on the drug side, I think is just huge. So we really value your group and what you do for our clients.
Thank you so much.
Well, Emily, thank you again. Hopefully you enjoyed this. I know this is more conversational, but I just wanted to remind clients that there are also 2 presentations on our YouTube page where you did a great job of walking through additional slides that talk about more of the details of this. So hope you enjoyed the podcast today, and thank you again.
Definitely.
Yep.
Thank you guys so much.
Great. And as always, we just ask listeners, if you have any family or friends that you think would find value from this, please pass this along to them.
Great. And you can always reach out to MP Group, specifically if you're looking at Medicare, and if you're looking from the planning side on that side, we'll be happy to help work with you.
Thank you.
Thanks.
Thank you.
Thank you for listening to this episode of the Live Greater View. If you like what you heard, please subscribe to our podcast on iTunes or Spotify and recommend our podcast to family and friends. To learn more about VLP Financial Advisors, please check out our website at vlpfa.com. Thanks again.
And now for our necessary disclosures. Securities and advisor services offered through Cetera Advisor Networks, LLC, member FINRA SIPC, a broker-dealer and registered investment advisor. All investing involves risk, including the possible loss of principal. There is no assurance that any investment strategy will be successful. The views stated in this podcast are not necessarily the opinion of Cetera Advisor Networks, LLC, and should not be construed directly or indirectly as an offer to buy or sell any securities mentioned. Due to the volatility with the markets mentioned, opinions are subject to change without notice. Information is based on sources believed to be reliable. However, their accuracy or completeness cannot be guaranteed. Past performance does not guarantee future results.